Good evening. Welcome to Left, Right and Centre. I'm Vishnu Shom. On the programme tonight, the government says that at the moment there are no signs of the mutant strain of the virus in India. It is, however, creating havoc in the United Kingdom. And there is a strong possibility that until the UK does bring its increasingly desperate situation under control, the travel ban from the United Kingdom may last for quite some time. But it's a fast-moving situation. On the show tonight, Dr. V.K. Paul of the Niti Aayog, and later on the show, Dr. Chand Nagpal, the chair of the Council of the British Medical Association, on how 90% of all beds in the UK's hospitals, not just COVID beds, all beds, are now full primarily because of the new strain of COVID. Joining us now, Dr. V.K. Paul of the Niti Aayog. Thanks so very much for being with us. It was great to hear that we don't at the moment believe that we've got this mutant strain in India. How important is it for us to keep on sequencing to ensure that that remains?
Vishnu, what we have said is that based on the surveillance system on genomic analyses of the virus being detected in the country in a systematic way, we have thus far not located this particular mutation. We have located several minor mutations, and they do keep occurring in coronaviruses, influenza virus, and so on. But the important mutation that we are talking about, this mutation has not been a signal so far. We have intensified our surveillance, genomic analyses, sequencing, and made it much more comprehensive in the wake of this new entity being described in UK. And we will wait and watch.
Dr. Paul, I know that scientifically it's not a more deadly strain, it's just more transmissible. But how would you respond to those who say that in fact it is more deadly because it is more transmissible? The more people get it, the larger number of potential fatalities.
Both the statements are true. Yes, indeed, once there is a strain which is much more transmissible to another set of strains, this is a matter of concern because it will infect larger number of susceptible people. And once such a situation occurs, the pandemic is accelerated. Then it comes with attendant effect in terms of morbidity, in terms of hospital requirement, and more transmission in the community. And therefore, yes, that statement is true. And that's why we need to be prepared for it. We would not panic, but we will intensify our measures. At the same time, fortunately, so far, the evidence suggests that it does not lead to severer disease compared to the normal strains and is not associated with high case fatality in terms of mortality influence that it could institute. But that's the information that we have as a preliminary information. That also from another nation, which has its own weather, conditions, other conditions, a health system. So yes, we should watch this very carefully. In a way, this is the kind of thing which scientists were always watching. And that's why I said that mutations have been occurring, even the strains that we have seen in India, but none of them has been of any significance. It was called a drift and not a shift. But right, when having this particular mutation is therefore to be watched.
So, Dr. Paul, I've spoken to Dr. Chand Nagpal. In fact, after your interview, we are playing out his interview as well. And what he says, it's because of a large number of young people not following the norms in the United Kingdom that, there was this mutation, or perhaps this mutation which has caused hospitals to be flooded with cases, 90% plus. Isn't that a real reminder to us that what people like you have been saying, we can't stop this because this is the biggest, clearest example of what can go devastatingly wrong, hospital capacity, if people don't listen?
Well, the second part is absolutely true, Vishnu, and we have been pleading, scientists community has been pleading, government has been pleading, the Honorable Prime Minister has been pleading for us to be very vigilant, to be behaving in COVID appropriate methods, ways, to avoid crowds and be sensible when we have festivities. That's truly valid. And we have seen that that kind of a vigil can never be lowered, as also are other measures for pandemic control, which means tracing, tracking, and so on. The point is that we at this moment would perhaps not be in a true position to know why this mutation occurred. There is another theory which says it occurred possibly in an immunocompromised individual where the virus lasted for a longer period than usual and had time to mutate, and then it spread. I think the jury is still out as to how it has come up. But as I said, mutations do occur spontaneously, very often, in fact, all the time. And to have a mutation of a significance to the tune of 17 mutations, and then this mutation which is enhancing its susceptibility, its tendency to enter the body of human beings is worrying. But then in a way, we were watching this development or this kind of development as a scientist nation and as well as other organizations such as the WHO.
So, Dr. Paul, which brings us to what everybody has been asking, and I'm sure you would have expected this question. We need the vaccines, particularly in a situation now where it's so important to inoculate our people, because the sooner you do that, if this does come our way, then there would be an element of protection, if not complete protection. So you today mentioned that the process of verifying the data is sacrosanct. That said, when are we going to get the vaccines?
Well, I think firstly we must remember that vaccine licensure or multiple licensures just are not, a set of magic bullets that suddenly billions of vaccines will become available, everybody will get vaccinated. No, that scenario is not out there anywhere on this planet for some period of time. Having said that, yes, indeed, once we have an effective vaccine, it is a game-changing intervention other than the interventions such as contact tracing and testing that I was referring to and COVID-appropriate behavior. So it strengthens our armamentarium and systematically allows us to increasingly immunize people so that the people are protected and the pandemic tends to then slow down. What is our dateline? I would very humbly submit that we are looking at rolling reviews of the data coming in from the vaccine candidates. It's very, very actively under watch and under scrutiny. And I assure you that even as we upkeep the scientific principles and frameworks, we hope and we are optimistic that an effective vaccine would be available very soon to India.
And you don't want to get into how many days this year or January? You don't want to.
No, that is not right, because that will try to put pressure on scientists and experts.
No, let's not do that. I take your point.
Remember, what would happen is that if we have anything which is soft on science, that's counterproductive. The situation and the narrative changes rather abruptly. And we have to be very clear that when we license a vaccine, it is safe, it's effective, it'll be something that I'll give to my grandfather, and so on. So that's something so critically important as a narrative and the reputation of our institutions, that even as that is going through, the vaccine data is going through that kind of a scrutiny. Yes, as citizens, as government, we all can hope that it'll happen sooner than later.
Dr. Paul, one or two more quick questions. Firstly, how does sequencing happen? Secondly, what will be the protocol for sequencing now that we have this concern in the United Kingdom?
Briefly, since coronavirus, including this particular virus, is an RNA virus. So RNA is like a thread, and it has multiple, there's a sequence of nucleotides, which is all said, and different parts of this thread are responsible for different proteins to be created once the virus is in the cell. So the part within this, the thread, which is responsible for the spike protein, which is the top structure on the virus, that particular part has shown a mutation. That means it has modified the protein of that spike on the head of the coronavirus, which is now allowing a more rapid entry into the cell. So when you examine the gene, in this case, the RNA of the virus, you are looking at the sequence and you compare it with the sequence that's available as a so-called normal virus, and you find it is different. Having said that, this technique and gene sequencing is scientifically complex, but it can be done efficiently. And we are very fortunate that in our country, we have a plethora of laboratories of CSIR, the DBT, and the ICMR and others, where large number of RNA obtained from the viruses can be sequenced. What we have done now is that we have accelerated the watch and the surveillance. Normally we would be doing, let's say, in a certain way, but in the wake of this signal, the comprehensiveness of how many RNAs you will sequence has been increased. It's also being targeted to the RNA being obtained, which means the virus, and therefore the RNA being obtained from the recent travelers that have come into the country. So a comprehensive, genetic sequence-based molecular epidemiological approach has been unfolded in a very quick way of responding to the current situation.
Sure. Just one final quick question. How much time does it take to sequence? We know, for example, as laypersons, an RT-PCR test takes between 6 to 7 hours, can't be really shorter than that. When you sequence this, how long will it take you?
The sequencing process is not particularly slow. It is rapid. The issue is to pick up the right kinds of specimens which represent the perturbance that is taking place in the epidemiology. What I mean by that is that people whom we are suspecting, or the sampling being done from people who have traveled into the country, how to reach them and get their specimens would take some time, because we have to locate them and get the sample done. Or let's say if samples are being done today, they'll be picked up and somebody has to be positive, etc. The sequencing itself is a matter of hours.
Right. Dr. Paul, it's good to speak science with you.
Thank you.
And it's interesting. I just hope that it's a better year next year. I'm sure it will be. Thank you very much, sir, for being with us.
Thank you, Vishnu.
One of the biggest concerns now around the world is the new mutant strain of the COVID-19 virus. It's broken out in the United Kingdom. There have been a very large number of cases which have been reported over the last several weeks in parts of the country, particularly in the south and southeast of the United Kingdom. Hospital beds are filling up fast in that country, and the big question is how long will it take before this particular strain of the virus is brought under control? Joining us now, perhaps one of the best voices in the United Kingdom to answer that question, Dr. Chand Nagpal joins us. He is a doctor. He works as a general practitioner, also the chair of the Council of the British Medical Association. Thanks, Dr. Nagpal, for being with us. Firstly, the hospital situation in the United Kingdom, how critical is it presently?
Yeah, we have a very serious problem now, because hospitals in England, many are seeing more patients now with COVID than during the first wave. We have many hospitals at full capacity. Only last week, 44 ambulances had to be directed away from the local hospital to other remote areas because there just were not the beds. And so we have a very serious critical situation in terms of our hospital capacity. And a lot of this is being driven by this new variant that has resulted in significant escalation of spread of infection, especially in London and the southeast.
Dr. Nagpal, what percentage of hospital beds remain in the United Kingdom at the moment?
We're seeing in some hospitals literally full capacity of beds. We've seen about 1/5 extra beds occupied by COVID in just 1 week. We're looking at occupancy levels around 90% or so, which means that there's very little laxity to accommodate urgent patients. That is the problem. And as I said, some hospitals are just completely full and are directing patients elsewhere. We have a National Health Service which has a duty to look after anyone who is seriously ill. So, there is this is a national issue for government, and the only way we will be able to control this is by reducing the spread of coronavirus, especially this new strain. So all of the efforts now are around controlling it. What we've done in London and the southeast is we're now in what's called Tier 4 restrictions. That means that no households are able to mix, only indoors at all. Only one person can meet with another person outside a household outdoors. All non-essential shops are closed. There is a ban on travel from areas in the Tier 4 restrictions, such as London, to other parts of the country. As you know, it's Christmas coming up, and there will be no mixing of families in the Tier 4 areas during Christmas. And in other parts of the country, there will be a very limited mixing on Christmas Day itself. So we are under severe restrictions nationally as a result.
A clarification: by saying that your hospital capacity is at 90% plus utilization at this stage, are you talking about dedicated beds and facilities for COVID patients, or are you talking about all beds put together?
Yeah, we're talking about all beds. And I think that's the other point, that not only is this having an impact on COVID patients, who are, of course, in highest numbers, increasing utilization of hospital capacity, but also this is having a dramatic effect on all other patients who may have acute respiratory diseases, who may have heart conditions, rheumatological conditions. In fact, this knock-on effect has resulted in millions of patients who are waiting at the moment for hospital treatment who were not seen during the pandemic. We have about 160,000 patients now waiting more than 12 months for operations. So this has had a huge impact on the health of patients at large beyond COVID.
Dr. Nagpal, is it true that there are younger patients coming in with this new strain?
Well, what we know is that younger patients are mixing more. We know that they don't have symptoms necessarily, so they don't even know they're carrying the virus. About 1 in 3 people do not know they're carrying the virus, and as a result, they can be the spreaders of the virus without knowing. And that's why it's really important that there are measures to prevent mixing of people. That's why we've got all the bars, restaurants, all closed at the moment in our restricted areas. So it's certainly a very real concern about spread. We've also introduced in the UK lateral flow tests, mass testing, which is picking up many people who are carrying the virus but don't know about it. That's becoming implemented across healthcare sectors so that we can identify asymptomatic spreaders. And on top of that, we have, of course, started our vaccination program, COVID vaccination program. We were the first nation in the world to start that. About 500,000 patients have already been vaccinated against COVID-19 using the Pfizer-BioNTech vaccine. And we've targeted those patients who are at highest risk. Those are people who are over 80 years of age and with other underlying medical conditions. So there are real efforts being made to prevent this infection spreading, but also to protect people as well.
Dr. Nagpal, will the vaccines work as effectively against the new strain?
Well, as you know, this is very early days, and so none of us can be absolutely sure, but the early scientific advice is that the vaccine should be effective against the new strain. That's what we've been told. But of course, I think we have to be very guarded in our position, because time will tell as the science unfolds. So we'll have to wait and see. But what I would also want to emphasize is that the measures that need to be taken with a new variant, and remember, this new variant is not an unusual phenomenon. Mutations occur with viruses all the time, and they have occurred with every flu season. But what's important is the measures are exactly the same as with the original coronavirus, which is to make sure that people do not mix, make sure that there's proper distancing between people, making sure you wear masks, hand washing. If you follow those rules, that will prevent spread of this new variant as much as it will prevent spread of the original virus. The only additional factor to recognize is that this new variant is more transmissible. It is considered to be around 70% more infectious in terms of spread compared to the original virus.
Is it more deadly?
There's no evidence at the moment, that it's more deadly. It's passed on more readily, which is why we have to take extra precautions to prevent spread. But there's no evidence that the effect of the new mutation is any more deadly than the original virus.
Dr. Nagpal, to the best of your knowledge, if we need to revise some of the vaccines out there, typically how long would that process take? And then how long would the process to actually stock up on a new vaccine or a modified vaccine take after that revision?
I think I'd rather not us think in those bleak terms, because the scientists are telling us at the moment that there is no reason to believe that this current the current vaccines that are available will not be effective against the new strain. Now, obviously, if things change, we'll have to revisit it. I think it's very hard to answer your question because it would require a modification of the current vaccines. I don't think there's any precedence in terms of the way in which this vaccine is being produced. We produced a vaccine globally in 10 months, which would have ordinarily taken 10 years. So we certainly know that where there is determination, we do collectively across the nation, scientists will deliver what's necessary. But at this moment in time, I don't want to be, for us to be portraying a bleaker picture than the science tells us at the moment.
Dr. Nagpal, given the present rate of vaccinating British citizens, how much longer would it take before you believe that a sufficient number of citizens have been vaccinated to give some sort of protection against even this new strain, and in the process bringing down the R rate, as it were?
Yeah, so I'm going with the assumption that the vaccine will be effective against the new strain. That's what the scientists are saying we should be assuming. Now, we've estimated that it's going to be at least until April or May that we will have vaccinated sufficient volumes of the population to really be able to say that the pandemic is in a way allowing us to mix like we used to do in the old days. So it's going to take at least until April or May. Now that means, therefore, that what the messaging to the public in the UK is that whilst there is hope for 2021, the measures to prevent spread and the vigilance that everyone needs to adhere to is exactly the same, and that no one should let down their guard thinking that things are going to be okay in a short while. They're not. It's going to take several months. I should also say that the vaccination program itself is quite a major task. I'm a GP, a family doctor, and we are now almost full-time, some of our doctors are spending in just vaccinating people, because of course the quicker you can vaccinate the population, the quicker we'll get to that point that you describe, where enough of the population is vaccinated that we can start to mix more freely, because the virus effectively will not be circulating in any significant numbers. But actually to vaccinate the entire population, or not the entire, but the majority of the population, is a huge undertaking. And it's taking doctors, nurses, other healthcare staff, away from their normal roles in order to deliver this ambitious but necessary vaccination program.
Dr. Nagpal, the reason I ask that is, if it's going to take a few months more to vaccinate a much larger number of British citizens, would it be fair to expect that a transport ban, which has been called by several nations around the world, would likely remain?
I think that this is a fast-moving area. As you've seen with this new variant, that things can change, whilst we're implementing the vaccination program. So I do believe that we're going to need to continue adhering to the same measures we've had to adhere to in the past. Now that means transport bans if you have a new variant like we have now. It will mean continuing with lockdowns if there are surges of infection in certain areas. It will mean adding new restrictions if things become uncontrolled in any one part of a nation, or so forth. So I think that whilst the vaccination program is underway, that it doesn't change any of the current measures and policies that we have to follow to control this virus.
One final question, because this affects thousands of Indian students who study in the United Kingdom. Many of them are stranded in the UK, unable to get home because of for Christmas, because of the ban on the suspension on air travel. But I think a lot of students would also want to know, if, irrespective of whether they're in the United Kingdom unable to come home or are already in India looking to go back, whether it's likely in January there will be a term of college. At this stage, what do you believe?
So this is a hot issue being discussed by politicians who govern the country, of course, because there has been a big debate around the cost of education or children not being educated if we close down schools and educational establishments. But at the same time, there is a serious issue of protecting the nation's health and making sure that we don't end up with the loss of more lives. We've lost 65,000 people from COVID in the UK, and on top of that, there'll be many patients who didn't have COVID who weren't able to be treated. So we do have to put the health of the nation first. So at the moment, no decision has been taken, but if there is a suspension of physical attendance at colleges, universities or schools, what will need to be done in place is more virtual learning, and there is now plenty of evidence and innovative approaches that are going on across the world in terms of blended learning and ways in which students can learn in a safe way remotely. So no decision has been taken, but I have to say that that is certainly an option, that come the new year, we may find that there will be delays in the reopening of educational establishments.
Last question. Prime Minister Johnson is expected to be in India next month as our Republic Day guest. In a situation like this, do you believe realistically he would be traveling? I know you can't answer that directly, but given the situation in the United Kingdom, the threat of this new variant, would it be wise for him to travel?
Well, obviously, we can't make a decision today about what may go on in 5 weeks' time, because as you know, we've seen the changes to the reality of this virus, on a day-to-day basis. But clearly, one consideration is that the trip to India may not be possible, especially if we carry on seeing this level of infection and spread. If something dramatically improves, if the current lockdown in London and the southeast, improves the spread of virus significantly, and we control infection within the UK, that may be possible. But remember, it's not just the UK. This new variant strain is also now emerging in other nations. We have no idea about the situation in other parts of the world. So I really, think it's very hard to predict what will be possible at the end of January. But you have to allow for the fact that international travel will not resume by that stage. You have to allow for that, and we'll have to wait and see.
Dr. Chand Nagpal, thank you so much for speaking to us and explaining the situation in the United Kingdom so articulately. It helps us understand what's happening. Thanks very much indeed.
Thank you. Thank you.